If you're still working and want to continue working after the age of 65 and have an HSA at work, chances are phenomenal that you've been told by the insurance agent that sold you your employer group health plan, or your HR director, or your boss, or all your friends, you've been told you can't continue to make contributions, either you or your employer, to that HSA once you turn 65. Stay tuned to this video to learn the truth. So the answer is they are wrong. And this is a crazy thing because we train thousands of agents around the country, and most agents don't work with people that are under 65. So they're not familiar with health savings accounts. They just start talking to people at age 65. Your agent, it might not be that she doesn't understand the rules. She has no need to know those rules. So don't get mad at whoever gave you the wrong advice. And thank you for watching this video where you're going to get the right advice. So the right advice is legally, yes, if you turn 65, you are not prohibited from continuing to contribute to your HSA. So you have a group plan with an employer that has over 20 full-time people. Okay, that's the threshold. So you are not required to take Medicare Part B or Medicare Part A. And as long as you don't take Medicare, you're eligible to continue to contribute to that health savings account. And a lot of people are working past age 65. I assume I will work 20 years past age 65, just like my parents are still working, and they're well over that. So if your employer's dumping in thousands of dollars every January, great. Just because you turn 65, that doesn't have to stop, as long as you follow the rule, and that is that you do not sign up for any other health insurance, and Medicare is health insurance. A lot of people don't think about that. So if you took early Social Security, they automatically signed you up for Medicare Part A. That's okay. You can file CMS form 1763. Call us, we'll help you with it. And pay back the money and get out of Medicare Part A. We're good. And pay back your Social Security. And we are good to go to continue to work as long as you want and continue to have those contributions to your health savings account. And then people ask me other questions about health savings account. The number one is, I have heard that I can use my money in my health savings account. I talked to a man this week and he said he had $25,000 in there and he's really excited about that pot of money, right? And he said, I've heard I can use it to pay for my supplemental insurance premiums once I do stop working. Is that true? And I said, and I love to say this, yes and no, right? So yes, you can pay for some premiums. No, you can't pay for all of them. So I'm holding this paper, might as well explain it. I do have a 2-page paper that kind of explains these if you would like it. If you go into the summaries, scroll all the way down, well, you'll see the comments. If you're on your phone, you have to go way, way, way down, but you'll see comments. Leave me your email and I will email you this paper to explain this because it's not that readily available. Okay, let's go back to my guy. Can he pay for his premiums? Yes, you can pay for some premiums. The number one premium you can pay for is your Medicare Part B premium. Remember, Medicare is insurance. Okay, so if you're in 2019, your Medicare premium for the average American is about $135. And if you're watching in 2020, it's about $147. And if it's 2021, you get my picture. They're going up, okay? So that money automatically comes out of your Social Security check every month to pay for your Medicare Part B. You can pay that premium with your HSA money. So how do you do that if they automatically take it out of Social Security? You're allowed to write yourself a check to reimburse yourself for that money. Some people will say, well, I'm not going to mess with that. I want to save it for the big stuff that my Medicare supplement and my original Medicare don't cover, such as dental, vision, hearing. And a lot of people do that. But some people say, you know, I'm like never going to spend all this money. And I'm already at such and such age. I don't want to lose it or waste it. What else can I do with it? Go ahead, start reimbursing yourself for that for your Part B premium. So can you pay for a Medicare supplement insurance plan? No. Can you pay for an HMO plan? Yes. Why is that? No idea. It seems random how you can pay for one type of supplemental plan and not another. That's the law. That's your government. I didn't make it. Can you pay for a dental plan, a dental insurance plan? No. Can you pay for a long-term care, nursing home insurance plan? Yes. You see where I'm going? It just looks a little across the board here. So, like I said, if you'd like my summary paper to help lay this out for you, go ahead and put it in the comments or call us at the Medicare Family. We'll be happy to send it to you. So now I had another person last week at a seminar, and he said, well, I've been continuing to contribute to my HSA, right? Because I was told that I could, and I'm going to retire. Is there any problem? And then other people were chiming in, and they said, no, it was just as soon as you go on Medicare, just stop contributing and you'll be fine. And that is true. The wrench in the system here is Medicare itself. So he's going to stop working at age 70, which is like in a month. And so he's not going to contribute to his HSA once he goes on Medicare. That makes sense. Don't use sense when you're talking about Medicare, okay? Medicare, when they sign him up, they're going to retroactive it back 6 months. So if you look back 6 months from now, any contribution he made to his HSA or his employer made was not qualified, was not allowed. So that money is in there, and that's non-qualified money. He's not going to get the tax benefit putting it in or taking it out. Does he go to jail? No. They don't take his money. He still has his money, but it doesn't have those tax benefits as if he would have done it correctly. And that means he would have stopped doing it 6 months prior to going on Medicare. So we need if you're getting ready to retire, this is something to consider if you're continuing to work. And I have people all the time at my seminars say, I want to continue to work. Can I continue to contribute? And I said, when does your employer contribute? January 1st. I said, okay, as long as you understand the 6-month rule, he's only dumping it in January 1st, you should be fine. The guy I had this week, he contributes every month. So he has to stop 6 months in advance. Now let's say you mess it up, which most people do, okay? You don't go to jail. It's not a big problem. Your accountant will have to figure it out. He's going to unwind it on the back end. And that money is not going to be able to be used for your qualified medical expenses. So I'm sure you probably are really thinking about a bunch of more questions about HSAs now. Call us at the Medicare Family. Talking to us is free. Email us, call us, text us. I don't know what you want to do. Send a carrier pigeon. I actually used to raise carrier pigeons, so I would appreciate a carrier pigeon message. We'll be happy to help you for free. Untangle this. We know Medicare is confusing. That's our job, and we love it, and thank you for watching.